welcome to my training on the easiest progress note technique. Clinicians generally don't like progress notes because you have to be careful, you can't make mistakes, they can be time consuming, and they take away from patient care time. My training will help you with all these things. How do I know this? Well, over 20 years experience, and I've written over 1,000 progress notes myself and audited the same amount or more. And I've successfully trained clinicians on how to pass audits by the Joint Commission, Medicaid, health insurance companies, and state regulators. So let's get started.
By the end of this training, you will be quick. You'll write your progress notes like the wind. Thorough. You'll cover everything needed. Outcomes driven. You'll know in measurable terms where the patient is and how far you've come. And lastly, responsive. You'll clearly show what you plan to do next. First, let's talk about some background. The rise of electronic medical records and internet solutions offer a variety of progress note formats. Although some appear fancy and have special bells and whistles, it's important to know they all cover the same 8 essential ingredients. If your progress notes cover these reliably, you're doing a great job. As you can see, we're talking about who is the patient, what was the therapy type, when did treatment happen, how long did it last, what did you find out during therapy, what did you do during therapy, what did you think about the patient's progress based on what you learned in therapy, and what's next. All of these ingredients are usually found in popular formats such as SOAP, DART, and DAP. Here's how they are in the SOAP format. If you're new to progress note formats, you'll quickly notice that SOAP, DART, and DAP are acronyms. You can see here that SOAP stands for Subjective, Objective, Assessment, and Plain. I've noticed with progress notes that people are most likely to get confused by what information to put where. I've laid out here the 8 ingredients in the SOAP format. You can also find the same in the SOAP progress note checklist. You'll notice that ingredient 5 needs to be asked 2 ways. Subjective, meaning patient self-report and opinion, and objective, meaning factual evidence, in the SOAP format. Here's the DART format. DART stands for Description, Assessment, Response, Treatment. The DART progress note checklist also covers this. You'll notice that ingredient 5 needs to be asked 2 new ways. Present status, meaning what's going on now, and improvement status, meaning how does now compare to the last measurement, in the DART format. Lastly, here's the DAP format. DAP stands for Data, Assessment, Plan. There's a checklist for this format too.
So to review, there are 8 essential ingredients to every progress note. The formats may be different and you need to be familiar with the format for your organization, but they're all the same ingredients. Now I want to make an important note here, we're not talking about other types of notes like notes on phone calls. They're important, but they don't need all of these essential ingredients, okay?
You need 3 things to be lightning fast and thorough. If you have these covered, high quality is a breeze. A session plan. In sessions, use the checklist offered with this training for your progress note format to practice and memorize the essential ingredients. Make sure you cover all the ingredients during the appointment. As you go through the session, imagine filling in the progress note sections. A symptom measurement plan. Be ready to measure the current symptom levels by the methods used in the patient's treatment plan. Have the treatment plan on hand so you can easily remind yourself. The last note. In order to refresh your memory about the patient's status, read the last progress note just before you start the appointment. Or if this is the first session after completing the treatment plan, read that instead. It'll probably take you about 30 seconds. Having this on hand will also help you write quickly because you can copy a lot from this note, especially if it is electronic or web-based. Isn't that cheating? Absolutely not. I'll go into why shortly. Never mind doing any of this if it is a group note. Just have the group notes on hand for each patient when you're ready to write progress notes. Now let's begin starting with the session plan.
When you do this the first few times, use one of the checklists offered with this training and feel free to edit it to your needs. Through repeated use, this will help you to memorize the essential ingredients. The essential ingredients, I think we can agree, are fairly easy to memorize, but sessions are not always so straightforward, and sometimes they're stressful. In times of stress, people tend to forget things, so using one of the checklists will keep you on your game plan even in a stressful situation. Real measurable progress starts with good measurement of symptom levels at the beginning of treatment. This is your patient's pre-treatment baseline. You and your patient know that treatment is working if symptom levels improve from baseline. See my treatment planning made easy training for the easiest methods to set this up. Let's use an example from that training. Jane.
So here's Jane. When Jane's treatment started, her symptoms of depression were feeling depressed daily at 7 out of 10, thoughts of suicide 5 times daily, and oversleeping 12 hours per night. Each appointment you want to take new measurements to see if things have improved. Although there are many ways to measure symptoms, I recommend methods that are easy to understand and to use, namely your own observations and your patient's experience of how strong or severity, ratings of 0 to 10 are good for this, how often or frequency, how much per minute, per hour, per day, per week, per month, etc., and how long or duration, seconds, minutes, hours, days, etc. As you can see from our example, Jane's baseline has one of each. A severity measure, feeling depressed daily at 7 out of 10. A frequency measure, thoughts of suicide 5 times daily, and a duration measure, oversleeping 12 hours per night. If your patient's measures are on your session checklist, you won't forget to cover them. To get these results, all you would need to do is ask. On a scale from 0, no problem, to 10, worst imaginable, how depressed do you feel now? How often have you had thoughts of suicide since I last saw you? For example, 5 times daily, more often, less often, etc. How long are you sleeping each night since I last saw you? Or, since I last saw you, when do you typically go to sleep and get up? Other measures might be test or assessment results like questionnaires or urine drug screening. Whatever the measure, be sure to talk about them and compare them to baseline. Is there improvement or none? How much improvement? Let's play this out with Jane. The measurement dialogue you have with patients covers 4 needed elements. Status questions. What are the patient's current symptom levels? Patient responses about the current symptom levels. Comparison to baseline, seeing if anything has changed and in what direction. For example, improvement, decline, or no change. Agreement. Patients won't believe there's been improvement if they don't agree with you. This last part is important and often overlooked or underdone. If you two don't agree, work is needed to come to agreement. Your opinion or assessment is valuable, but agreement between you and the patient is fundamental to the patient trusting your assessment and the patient adjusting his or her options and actions to do something more constructive. You know, the whole reason he or she came to therapy in the first place. In order to stay aligned, always try to come to agreement each time you measure a symptom. A little more on agreement. If you get the sense that your patient doesn't agree with you, time should be spent talking with your patient about the disconnect. You need to know if there is a problem with 1. The measures you've chosen, 2. The questions you're asking, 3. The comparison to baseline. For example, it doesn't feel to the patient like there's been progress even though you both said so. Or 4. The patient's responses. For example, maybe she is being overly positive to please you but is not being accurate. Or maybe he is trying to hide the extent of his addiction by saying he is drinking less than is actually true. If there's a problem with any of these things, you'll need to work with your patient to change them to something you both can agree with. If you don't, therapy will get detached from measurable progress and from a belief in progress. There's a risk of losing hope. Hope is a key ingredient in treatment. What's left? Let's take a moment to fill in the ingredients we know so far for Jane's progress. As you can see, by now you've got 5 out of 8 ingredients covered. your symptom measurement plan got you most of what you need for ingredient 5. Look at this quick way to write it. So let's get you quickly through the last 3 ingredients. Ingredient 6, what did you do? Here's a quick way to write this. You'll notice that this area overlaps somewhat with ingredient 5 since you find out things as you discuss them. To cover both, include briefly what you found out, done in parentheses, for each topic you covered. The sentence for ingredient 6 will be the longest one in your progress note since it is the main content of any session. Suicide and homicide risk, when they arise, always require you to cover a number of unique critical elements, as you know. Organizations often have a protocol you should follow for this. In contrast, this example is a general one. Ingredient 7. What did you think? People often feel compelled to say a lot here, but you really don't need to say more than a brief statement. Here's a quick way to write this for Jane's session. Ingredient 8. What next? This is, of course, what you and the patient will do next, either before the next appointment or in the next appointment. Here's a quick way to write this for Jane's session. All together now, here's everything. But that doesn't look like a progress note. You're right. Let's get out the soap. Here's a soap note, and all the standard ingredients fit into their proper locations. Let's throw a dart. Sorry, I can't think of a good pun for dap.
Did you notice that all progress note types handle who, what, when, and how long the same way? They also handle A, or assessment, the same way. And P, or plan in SOAP or DAP formats, is the same as T, or treatment in the DART format, and they're always at the end. No progress note type is any better or worse than any other type. Now, for those of you who look at the progress note we just completed and think it's a little bit more than you wanted to do, consider this. If you do it this way for the first note, you can electronically save that and use most of that for the second note. It's not a cookie-cutter approach as long as the content you are discussing and the symptom levels of the patient are new.
Let's recap. To be quick, thorough, outcomes-driven, and responsive, you need a session plan to cover all 8 ingredients, a symptom measurement plan to measure the current symptom levels and to get agreement on progress, the last note to remind you what was going on last time, saved electronic notes to borrow from when you're writing progress notes. As I said at the beginning, progress notes are your best friend and your best tool for helping your patients track success. Nothing fancy, nothing complicated, just simple ingredients to help your patients recover.
I hope you've enjoyed this video. Now your progress note should be quick, thorough, outcomes-driven, responsive, and less stressful. Best wishes.